we, through the Pediatric Real World CAR Consortium, collected clinical data on patients that have been treated with commercial Tisagenlecleucel, including pre-infusion labs, and then kind of their toxicities and then outcomes of those patients. And through this group, we identified a population of patients that had very high ferritin levels, organ toxicity, coagulopathy, that met criteria for having HLH-like toxicities. And then we went back, after finding that these patients seemed to have worse outcomes, we went back and looked at what labs were associated with the development of those HLH-like toxicities. And in order to do that, we first found what labs seemed different in this group, and we identified a group of 5, or a list of 5 variables that seemed different. It was disease burden, ferritin, CRP, platelets, and neutrophils were all different in the group that had HLH-like toxicities compared to the group that did not. And then we took those variables and we did an ROC analysis for finding the optimal sensitivity and specificity, kind of a cut point for each of those values, and then put that into a multivariable model in order to find which were the most predictive for developing HLH-like toxicities. And these were all before CAR T-cell infusion. And what we found was that the disease burden and the being high and the neutrophil count being low were the 2 factors that seemed to come out as being significant for predicting HLH-like toxicities. And of the 2 of those, the disease burden being over 25% was a stronger predictor of who would develop HLH-like toxicities. And the ANC cutoff was 200, and being under 200 was still predictive independently of disease burden, but not as predictive as disease burden was. And then so we created a risk score based on disease burden and ANC that kind of put people in risk categories 0, 1, 2, or 3, and gave post-test probabilities for each of those risk scores. And I think this work is based on commonly obtained labs pre-Tisagenlecleucel. There's also been work done on cytokine values that can be also very informative, but this is sort of for if cytokine values are not available, this can serve as a way of predicting who is most at risk of developing these toxicities, and maybe warrants study into early anti-inflammatory treatments to prevent these severe toxicities in that high-risk group.